Morning, everyone. Hang on, I got an echo. All right. Well, I still got an echo. Hang on. All right, how about now? Okay, that made sense. That was confusing me for a moment. Good morning. Wednesday, November 11th. It's our day 3 of refresher. I think our first physician speaker is in the neighborhood, not in the building just yet. So I just wanted to say good morning to you, get started on time. Couple quick things. I think we have a pretty full slate today of things for physician speakers maybe coming in now. So maybe putting you on mute and just if y'all hang out for a minute. Before we actually get started here and to get him set up, because it's right at 8:30 and we may take a moment to get his program installed on the computer. Just want to clear off a thing or two here. Make a quick mention that it being Veterans Day. Just want to say thank you to anyone out there listening to us and doing this refresher with us this couple of weeks. That today is Veterans Day, and thank you for your service. All right, I hear that physician coming in now. Let me go ahead and mute my mic, so just stay tuned for a moment. We'll come back to you here in just a second. All right, folks, we're back.
Hey guys, I'm Dr. Pezeshkian. I go by Pez in the ER. Thank you for your time this morning. I know I have quite a few slides, but I'll try to get through it as quick as possible. A lot of this stuff we've covered last year. Stuff that I've added on this year has been, of course, COVID, SARS-2-CoV information. That's been the pandemic that's kind of been plaguing us all. A little bit about me. I'm from Los Angeles, California. I went to medical school in Arizona, and I'm here in Joplin now. I really love it out here, kind of digging my heels into the city, and I love working with all of you. Thank you for all your hard work. It is much appreciated. All right, so without further ado, I know you guys are really excited about this PowerPoint. I'm going to go ahead and start presenting. So today's topic is going to be infectious disease in emergency medicine, particularly during transport. So when I was making this PowerPoint, the top 10 diseases that we see frequently, the first is going to be HIV/AIDS, then would be Ebola, and then number 3 is going to be SARS, the original SARS. 4 would be malaria, anthrax, cholera, the bubonic plague, influenza, typhoid fever, and smallpox. And so this didn't take into account the ongoing pandemic. Sure, that's what everybody is fretting about right now, and that's what we're dealing with, but still HIV/AIDS is the top disease that plagues the world. So how are diseases spread? There are 3 terms that loosely define the spread of disease. One is going to be called an endemic, one is called an epidemic, and one is a pandemic. And as we see with the SARS-2 or COVID-19, they keep referring to it as a pandemic. And definitionally, a pandemic occurs over a wide geographic area which affects an exceptionally high proportion of the population. An endemic is a constant presence of disease or infectious agents within a given geographic area. And then an epidemic occurs in a community or region of cases of an illness or an outbreak clearly in excess of expectancy. So I would categorize the COVID-19 as a pandemic because it's just everywhere. There are 4 categories of concerns related to exposure to humans, one being bacterial infections, rickettsial infections, toxins, and viruses. And we'll delve a little bit into each one here in a little bit. So how do we transmit infections? Well, most commonly it's going to be person to person, animal to person, mother to unborn child, and then we'll have indirect contact, so touching an infected, inanimate object and then touching yourself without thoroughly washing. And so with this whole pandemic, the 2 things that everybody has been telling us to do is A, wash your hands frequently, and B, make sure you wear a mask. And when we do these, we kind of slow or attempt to slow the transmission as much as we can. So personal protective equipment and practices. Hand hygiene is the primary protective measure. Using antimicrobial alcohol-based foams or gels, they're okay, but the best way to promote hand hygiene is going to be hand washing. And then you also want to make sure you cover open cuts or sores with a dressing. So personal protective equipment includes gloves, eyewears, gowns, surgical masks, N95s, needle-safe or needleless devices, biohazard bags, resuscitative equipment. And now we're using face shields, which are also beneficial. We have waterless hand washing foam or gel. If we're in a quick bind and we really need to, get our hands somewhat sanitized, the waterless hand washing foam or gel will be sufficient. So there was an algorithm that I saw on the CDC website that talked about signs and symptoms, and then it breaks it down into what we can consider. So if it's a gastrointestinal bug versus flu-like illness, versus a cough, respiratory illness, and skin infections, and then prior antibiotic resistance infection, if you see on this right-hand side over here, you could see the different examples of some of the bugs that we may be considering. And another algorithm for dispatch screening. So a 911 call for a sick or ill person. Well, is there a local infectious disease outbreak? An epidemic screening question. I'm sure now we all ask, do you have any fevers, chills, any shortness of breath? Now, there are questions that we've incorporated any lack of sense or smell or taste, headaches, anything that's indicative that will give you some kind of clue as to what we're dealing with. Always helps the EMS personnel, and it's really, and you guys do such a great job when you call in at Freeman and say, hey, we have this patient that we've picked up, these are the symptoms that they're presenting with. It's kind of like you're indirectly telling us, hey, this is what we're dealing with and this is what we're bringing, so get ready. And you're preparing us to prepare ourselves as well. So it's kind of a hand-in-hand relationship that we have with you guys. And like I said before, I think it's very unique and I appreciate it quite a bit. So we could talk right off the bat, we could talk about the novel coronavirus, COVID-19. Started in Wuhan, China. Animal to human transmission, human to human transmission. It's a viral illness. The first U.S. case was in Washington State. Now it's everywhere. I mean, there isn't a place that it isn't. So causative organisms is going to be SARS-CoV-2. Signs and symptoms: fever, cough, tightness in chest, and shortness of breath, alongside lack of taste and lack of smell, headaches, myalgias, high fevers as high as 104 degrees are some of the symptoms that we are seeing. So risk groups, of course, it's older adults. To take a side note and share a personal experience, I had the COVID last week or a week and a half ago, and it sucked. The myalgias were just beyond measure, and I'm sure those that have had it can relate. The body aches are something that I've never felt before. The sensation on your skin is just an icky feeling that I just can't get rid of. And then comes the lack of the sense of taste and smell, and it's simple things like that that I think we take for granted. You know, now that I eat food, it's very bland. I don't really know what I'm tasting. Or if I drink water or coffee, they all taste the same. And it's so sad that simple things like that get taken for granted in everyday life. So it sucks, and I can only sympathize for the older patients who have chronic illnesses already, and this is just the sprinkle on top. I'm sure they feel very crummy, and that's why they're the most susceptible group that can get more sick. So to add people who have serious chronic medical conditions like heart disease, diabetes, lung disease, and now in younger adults ages 20 to 54, nobody's immune to this thing. There's a wide spectrum. Everybody is going to get it. Everybody can get it. So it's affecting everybody. So the CDC defined some recommendations as to how to maintain a physical distance that will limit your chances or your exposure risk. And they started saying, well, you have to begin with 6 feet of distance within the room area for a prolonged period of time without PPE. And then they said anybody caring for, living with, or visiting or sharing a healthcare waiting room or with a known COVID positive patient or having direct contact with infectious screening of a known COVID patient while not wearing PPE. And it's the hardest thing to do, especially in an ambulance, is because you're in such a tight, confined space. So how are you going to maintain a 6-foot distance from a patient who is breathing fast? And I'm sure when you go pick them up from home, they don't have a mask on. You guys are doing great trying to protect yourselves, but it's not the end-all be-all. Things can go ahead and escape from the masks that the patient is wearing or that you guys put on them. And if your mask isn't tightly fitted, once that thing leaks, the chances of transmission are very high. This slide came out quite bad, and I apologize for it. But COVID-19 features, as we've talked about, fevers and symptoms of lower respiratory illness, the epidemiologic risk, if anybody has traveled from to or Wuhan, China, 14 days before symptoms, close contact with a person under investigation, or 14 days close contact with an ill lab-confirmed patient. Those were the CDC's definitions. And to note, the onset of symptoms as recommended by the CDC or speculated by the CDC is within 2 to 14 days after exposure is when you may start experiencing symptoms. Some start experiencing a day after exposure, some 2 days, but that's kind of the general time frame as to when people start showing symptoms. So the mode of transmission in COVID-19, respiratory droplet precautions and contact precautions. That's been the staple of recommendations from the CDC for as long as we've been hearing about this. So for droplet precautions, standard precautions, surgical mask and use, and try to maintain the patient within a 3-foot distance. Wear gloves, gowns, clean and disinfect all contact items, the blood pressure cuff, the stethoscope, and then you can wear a face shield as well. That is per the CDC's recommendations. If there is a shortage of PPE, some may recommend wearing a surgical mask, and on top of that, you can wear a face shield, but you have to wear both. You can't wear one and not wear the other. Incubation period is within 1 to 14 days after exposure. And prevention, early recognition and control source. Apply standard precautions for all patients and implement droplet and contact precautions. And I think this is kind of a silly slide because we're doing our best to prevent it, but we're only human, and we all at some point in time have to go to the grocery store. And I was going stir crazy at home. I was at home for 10 days. I needed to get out of the house, but I couldn't. So, unfortunately, people are going to get up, they're going to go out, and the scary thing about this virus is the first couple days you feel like crap, and then afterwards you feel like your normal self. Day 4, day 5, you feel like your energy levels are back, you feel normal again, but you're still shedding the virus. And then day 6, you'll kind of take a dip down, and then day 7, you'll feel great, and then day 8, you'll take a dip down, and it's kind of a roller coaster, but that's why the isolation precautions are so vital, is because throughout that 10 or 14 day period, you're still actively shedding the virus. So you could feel great, but somebody who's susceptible, who's at the market, who may or may not be wearing a mask, can pick it up. So surgical mask versus N95s, like I said, it depends on the risk and the supply. If there is a significant shortage, which we were dealing with initially, of the N95 masks, the CDC came up with guidelines saying you can use a face shield, goggles, and you can wear a surgical mask. All patients that are under investigation should have a surgical mask on during transport. And the CDC keeps updating their guidelines as further recommendations are made. So, again, I want to thank each one of you for transporting the patients as safe as possible. You guys do not have the luxury to be in a adequate distance of 6 feet or greater. So you guys are right up in the patient's face within close contact. And it is such a selfless act that you guys perform day in and day out. You guys are true frontline heroes, taking care of each and every patient that you come into contact to. And from the bottom of my heart, I thank each one of you. You all do such a phenomenal job in bringing patients safely to the hospital, not only caring for them, but also taking into account how you can protect your docs that will carry the care further after you give them to us. That's my little spiel on COVID. Now we can go through some bloodborne illnesses, and we'll kind of blast past some of these slides. So hepatitis is pretty big. We get a lot of patients that come in with severe abdominal pain, and sometimes we think it's the gallbladder, sometimes we think it's the pancreas, and if everything starts looking normal, we get a hepatitis panel on them, and the hepatitis panel comes back positive. So there are 5 distinct forms: A, B, C, D, and E. They vary in the means of transmission. I remember at a point in time, there were quite a few patients coming in diagnosed with hepatitis A, and the most common way to transmit hepatitis A is going to be fecal-oral. So somebody goes to the bathroom, somebody touches some feces, doesn't really wash their hands or doesn't wash them adequately. They come meddle with the food that you're about to eat. You don't know, because either you're dining at a restaurant or something. The food tastes great initially, and then comes the pain afterwards. And we can't really control that, so that's why the health department does what they do. So hepatitis B is a second form of hepatitis. Needles are implicated in transmission. Incubation period is within 45 to 200 days, and it's communicable from weeks before symptoms appear and may persist for years. Patients you start noticing that they look yellow, they look jaundiced, they have a loss of appetite, they have abdominal discomfort, and you can see their eyes. They look like they have highlighter color eyes, and underneath their tongue, sublingually, they can have some jaundice. Management: use gloves and good hand washing. Paramedics should be immunized, and they should practice standard precautions. If you're exposed, you have to notify the boss or the infectious disease guru. And it's hard because a lot of you do such a great job in trying to start IVs en route. I know I don't have a steady hand to do it while we're transporting the patient. And I thank each one of you, because again, you're putting yourself at risk. The patient can be combative, can be altered. You're trying to get an IV in. The car is moving, and it can happen very quick. One needle stick can happen very quick. And like I said, it's important to try to protect yourselves as well, because each one of you has a family member, spouse, kids, and loved ones, and it's important that you guys do your best to take care of yourselves as well. Talk a little bit about hepatitis C. It's blood-to-blood contact, sexual contact, organ donation, which is very rare nowadays that we see it, and unsafe medical practices, and it can be transmitted mother to infant. Incubation period in comparison to hepatitis B is shorter. This is within 2 to 24 weeks. And the opioid epidemic and hepatitis C in the United States is becoming greater and greater. There's a fentanyl craze going on, and I don't know where everybody's getting these drugs from, but drugs are bad. Signs and symptoms are the same as hepatitis B. Phase 2 signs and symptoms do not develop. So use gloves. Testing begins with the source of the patient. 24 weeks of treatment with a drug cocktail results in a 75% cure rate. And then hepatitis D is co-infected with hepatitis B. Transmission is percutaneously, and the incubation period is within 30 to 180 days. It's infectious during all phases of the illness. Signs and symptoms, again, they're all similar. And then use gloves and needle-safe or needleless devices to protect yourselves. Perform routine cleaning. Testing begins with the source patient. We can talk about HIV now. HIV is transmitted through blood and body fluids. Pathogens attack the immune system. Takes about 7 days. May occur within 4 to 6 weeks after exposure, and the communicable period is unknown. Assessment: acute febrile illness, malaise, swollen lymph glands, and then seroconversion occurs usually within 3 months after exposure. So again, use gloves. When in contact, use needle-safe or needleless devices. Practice great hand washing technique. Routine cleaning of the device, and healthcare workers are at risk day in and day out, because starting IVs, giving medicine, It sucks. Like I said, it's a selfless job, and each one of you is a selfless individual, so thank you. Now we can talk about AIDS. The incubation period is between documented infection and development of end-stage disease. Communicable period is presumed to last as long as the patient is seropositive. So even if the patient is symptomatically okay, but they are seropositive, you can still get it from them. And then there's some conditions that are AIDS defining, which include pneumocystis jirovecii pneumonia, cytomegalovirus, Kaposi sarcoma, atypical TB, and cryptococcal meningitis. These are some AIDS defining illnesses, and they tether along the CD4 count. As the CD4 count starts dropping and becomes fewer and fewer, then you are more susceptible to picking up some of these conditions. So you want to make sure you follow standard precautions. If exposed, you got to get tested, and then you may be given antiretroviral drugs. So moving forward, we could talk about bacterial infections. Flu season is here. Pneumonia season is here. So the most common causes of community-acquired pneumonia is going to be strep pneumo, Haemophilus, Staph aureus. Then we can have atypical pneumonia, which is Mycoplasma pneumonia, Chlamydia pneumonia, Legionella, TB, and Mycobacterium tuberculosis. We're going to get patients that come into the ER. They're going to call the ambulance and say, oh yeah, my ear hurts. I can't drive to the hospital. I'm going to call the ambulance for this one. And it can be strep pneumo, just a strep pneumo that can cause some ear infections. And then we get some more serious infections, bacterial meningitis. So again, strep pneumo, Neisseria meningitis, Haemophilus influenza. And if you notice, the same bugs that can cause pneumonia can cause an ear infection, can cause meningitis, can cause eye infections, can cause sinusitis, can cause upper respiratory infections. So it all depends, it's very trivial. Where is it going to hit? So can you really isolate what bug it is with the symptoms? No, we don't know. And then skin infections, staph, aureus, strep pyogenes, Pseudomonas, more commonly seen in diabetic patients. And then urinary tract infections. We get patients all the time from the local nursing home. Oh, the patient isn't acting right. They're acting altered, and you guys go pick them up, and they obviously smell like urine, and or you pick them up from home, and they smell like they've been sitting in a puddle of pee for a couple days, and they're sick. So meningitis is inflammation of the meninges. Bacterial is communicable, viral is not communicable. Meningococcal meningitis is most often involved in epidemic outbreaks. Pathophysiology is going to be direct contact with infected nasopharyngeal secretions, prolonged contact time of 8 or more hours. The incubation period is between 2 to 10 days. And communicable period is variable. So same way you can pick up COVID-19 is the same way you can pick up meningitis. It's nasopharyngeal secretions, and the communicable period is variable. Signs and symptoms include fever, headache, stiff neck. We do some testing in the ER, simple test. If you lift your neck off the bed, if your back lifts up off the bed as well, it's indicative of a Kernick sign or Brodzinski sign. Management: place a mask on the patient, use standard precautions, treat symptoms, and post-exposure treatment includes ciprofloxacin or rifampin. Rifampin is what we use most commonly. Respiratory infections, tuberculosis, TB is not highly communicable. 3 types. You have typical TB, atypical, and extrapulmonary. Patients at risk is going to be the malnourished and incarcerated persons, healthcare workers as well, because to go back, sometimes we get patients that come in, they say, oh, you know what, I've been coughing up blood for the past couple days. Well, why didn't you come in earlier? Oh, well, I didn't know better. And, they either come by ambulance, they don't share that information with you, or they come from the front doors of the ER and they don't know they have TB, but they can be exposed, and now they're sitting and exposing others. So it's very trivial. You can have multi-drug resistant TB, and you can have extensively drug resistant TB. It's just the severity of illness can get worse and worse. Transmission is by airborne particles, and the incubation period is between 4 to 12 weeks. When a lesion develops in the lungs, it starts becoming communicable. Early infection can be detected by a skin test, and I know we get TB tests every 2 years. And if it comes back, the infection site comes back raised, then they can go ahead and do a chest x-ray and make sure that you don't have any pulmonary involvement. Most commonly, on chest x-ray, the lower lungs are affected in primary TB and secondary TB. The upper lungs are going to be infected. That's kind of the pattern of progression that we see on chest x-rays. Symptoms include night sweats, fatigue, bloody sputum production, and hoarseness of voice. And these are such vague symptoms because now, even with COVID-19, patients are complaining of having night sweats, and they're tired, and they're having a sore throat. So that's why simple precautionary measures go such a long way, because you guys really don't know. We really don't know what we're dealing with when we pick up a patient from home. So management of TB, you want to make sure that we place a surgical mask on the patient, administer oxygen or ventilatory support, and then we have to report the incident, and then we clean the vehicle after transport. Pneumonia is the next topic we're going to talk about. It's going to be inflammation of the lungs. There are more than 50 types of pneumonia identified. Most types are non-communicable. If you think back to the slide that we talked about before, we have the most common causes of pneumonia, which include strep pneumo, Haemophilus, and then we have some atypical stuff that includes myco, bacterium, and Moraxella, and other bugs that are atypical of pneumonia. Assessment: the most susceptible patients are going to be the older adults, heavy smokers, alcoholics, chronically ill, immunosuppressed, and the pediatric patients. Signs and symptoms include high fevers, chest pain, productive cough, and respiratory distress. Management: antibiotics, and then put a mask on the patient or the paramedic to reduce exposure. And to go back to the whole COVID-19, I think the only good thing that has come out of it is that we're becoming so obsessive with putting masks on patients that maybe we'll see a decrease in transmission of everything else that we're not so, that we see regularly. Maybe pneumonia won't be transmitted as frequently. Who knows? It's something to think about. RSV is going to be huge. We're getting into the winter months. Kiddos are going to get it. Adults are going to get it. It's a virus, so there isn't any real antibiotic for it. You just have to ride it out. Transmission is going to occur by large droplets and indirect contact with contaminated hands or items. Incubated period is about 2 to 8 days, and again, it's more commonly seen in those kiddos that go to daycare in the winter months. Sneezing, runny nose, and a cough is some of the signs and symptoms that we see. And then the disease progression may lead to pneumonia, bronchiolitis, or tracheobronchitis. Management is going to be, again, PPEs, and then post-transport cleaning of the vehicle is important. Post-exposure treatment is supportive, so you just have to write it out. We have a couple more slides. We have about 20 more slides, and when I first made this, I was like, oh my goodness, I put together a 76 PowerPoint slide. I'm going to put them to sleep, and I'm going to talk for hours. But luckily, I think we're doing okay on time, and we'll get through the rest. So, zoonotics and parasites, we don't see them that commonly. Some of them we see more than others. First one is going to be scabies. And scabies is caused by the Sarcoptes scabiei, transmission, skin-to-skin contacts, incubation period, 4 to 6 weeks, communicable until mites and eggs are destroyed. We see most of these patients that come from either home, there are a couple of frequent flyers that have recurrent scabies infections, and then from some of the nursing homes. Once there's an outbreak, it just spreads like wildfire. So that's what the bug looks like. It looks kind of scary. I don't think I'd want it chomping under my skin. So signs and symptoms include rash, intense itching, and sores from scratching. Most commonly affects the webs of your fingers, behind your knees, in the webs of your toes, and it just itches and patients scratch. Once they start scratching and they continue scratching, there's bacteria that live on the surface of your skin as is, and if they're not hygienically up to par, well then they're going to cut a sore in their hand, and then they're going to have a systemic infection, and they're going to come to the hospital looking really sick. So management is going to be prevention by wearing gloves and practicing good hand washing techniques, routine cleaning for vehicles and linens, and then Lindane is a topical treatment that we can go ahead and put. Lice, we don't see lice too much. I haven't seen many here, but they crawl through the hair, they feed on the blood. 3 types, you have head lice, body lice, and pubic lice. Acquired through direct contact, we see them when they're kiddos, and transmission is through intimate or sexual contact. Incubation, pubic lice is, incubation period is between 8 to 10 days after eggs have hatched, and it's communicable until all lice and eggs are destroyed. Signs and symptoms, itching, irritation, sores, and nits. Management is going to be wearing gloves and practicing great hand washing, routine cleaning of the vehicle is sufficient, and then permethrin cream may be prescribed. So the last couple of slides I have is on fecal-oral transmission. Again, this is what the health department does great. They go ahead and they look at the local restaurants, they grade them, look at the quality of food, look at the hygienic practices of the restaurant or the butcher shops, and they give them a grade. If they need to improve, well, they must take those recommendations into consideration before they get shut down. So C. diff. C. diff, most commonly seen after a patient is on a course of a certain antibiotic or has had a prolonged hospitalization stay. It's a spore-forming bacterium that causes watery diarrhea. They say you can smell C. diff. Well, I don't know how that's going to work for me now since I've lost my sense of smell, but I'm thankful for that. Transmission occurs by contact with surfaces contaminated with feces, resolves 2 to 3 days after discontinuing antibiotics and starting a different antibiotic. Signs and symptoms include frequent, watery, green, foul-smelling diarrhea, nausea and vomiting, loss of appetite, abdominal discomfort. Those are some cardinal signs and symptoms. You want to make sure that you're using gloves and practicing good hand washing techniques. Clean surfaces with chlorine-based solutions, and then if there's an open skin contamination, we have to go ahead and report it. Norovirus, most commonly seen on patients who take cruises or come off of cruise ships. Transmission is going to be person to person. ingestion of contaminated food or water, and then aerosols created from vomit or diarrhea. Symptoms may appear within 1 to 2 days. So to note, C. diff is treated with antibiotics because it's a bacterium. Norovirus is a virus. There isn't really any antibiotic that you can go out and prescribe to help patients recover from norovirus. So a lot of the management of patients like this is going to be symptomatic treatment. Signs and symptoms may include forceful vomiting, watery diarrhea, weakness, and low-grade fevers. Management is going to be wearing gloves and practice good hand washing, and then you want to clean the transport vehicle using chlorine-based products. And hepatitis A is another fecal-oral transmission. So how we talked about the other hepatitis, B, C, D, and E, that are from either needles or blood or sexual contact. Hepatitis A is most commonly fecal-oral. So infection is most often described as benign. Incubation, and what that means is it's self-limited. Incubation period is within 2 to 4 weeks, and the communicable period is from the end of incubation to a few days after jaundice. And the example that we read in the books is a patient who's a chronic smoker gets sick and then all of a sudden has a lack of interest in smoking, and for a period of 30 days. And so that's kind of what happens in hepatitis, is that they become jaundiced, they start not wanting to smoke, they are tired, they have a lack of appetite, they're nauseous, they are vomiting, they have diarrhea, their stool color is pale, and they have some abdominal discomfort. And the best way to prevent this is by adequate hand washing. So the next several slides will go ahead and talk about the several phases. So phase 1 of hepatitis A includes fatigue, loss of appetite, fever, nausea, abdominal pain. Smokers lose interest in smoking. Phase 2 will be jaundice, dark colored urine, whitish stools, and then after a couple weeks it goes away by itself. So how do you prevent it? It's by, again, good hand washing techniques and using gloves. And hepatitis D we talked about with co-transmission with hepatitis B. Again, this is through percutaneous or mucosal contact with infected blood. Talked about hepatitis E. Hepatitis E is also fecal-oral. The incubation period is a little longer. It's 15 to 64 days. And the communicable period is the same as the hepatitis A virus. Signs and symptoms as other forms. You want to make sure that you're using gloves, good hand washing, and you want to clean the equipment. And that is all I have for you guys. I'd be happy to take some questions if we have questions from the audience. I hope you guys enjoyed the presentation. I know I tossed a lot of names of bugs and diseases, but the most important takeaway is going to be A, protecting yourself, B, protecting yourself, C, protecting yourself, and then good hand washing and good hygiene. Making sure the ambulance is clean and sanitary, as all of you are very obsessive about doing that. So that's the best way we can decrease the transmission of most of these bugs.
We're on again.
So I think there was a question that came up about certain blood types and being resistant to coronavirus by Shane. And Shane, to answer your question honestly, I don't think resistance is the right word to describe it. I think the severity of symptoms may not be as strong in certain blood types or blood groups. They say that, I think if I'm not mistaken, the O positive group is, or the O blood type is the least severe, but A and B have a greater severity of symptoms. But I don't think anybody is resistant to this. I think it's just so profound, and the mutation. My sister just finished her PhD in molecular biophysics, and they were trying to clone or replicate this virus to study it further and then study treatment. And she said that every time they sequenced the genome of this virus, it mutated so quick that as soon as they finished with the first sequence, it had already changed form. And that's kind of what we're seeing consistently everywhere, is that it's starting to affect different age groups. It's starting to affect people differently, and it just keeps mutating on, and we will unfortunately have to just keep developing resistance. What I will say is there was an article that came out not too long ago that they've been developing the vaccine, and it seems like they're having pretty good results with the initial set of data that's coming back from those patients that are vaccinated, or the trial, the study group that's being vaccinated. I hope that answers your question.
All right, folks. Jeff here, real fast. We're going to switch out our speakers and make a few changes on technology, minor stuff, to try and reduce that buffering time and our delay. So I'm going to go ahead and end the live stream for now. We'll start back in hopefully just a few minutes. I'll send out a message, or you'll just pay attention to this channel here.